Patient readmissions can be an extremely costly occurrence at hospitals. A patient's return to a hospital is typically considered a readmission when it occurs within 30 days of the patient being discharged. There are obvious financial costs associated with insufficient care and the repeated treatment of patients for issues that could potentially be resolved with fewer hospital visits. And on top of financial impact, hospitals today are often required to disclose their readmission rates for certain conditions, opening them up to public scrutiny or even government penalties for failing to maintain acceptable rates. For hospitals that build their applications on InterSystems IRIS for Health, there are a number of features that can be leveraged to reduce readmission rates and improve patient care. In this demo, you will see some of these features in action. 3 different components, each including instances of InterSystems IRIS for Health, make up this sample application environment. There is a health information component, an integration component, and a data component. In addition, the data component will use connections to third-party technologies, such as Apache Spark clusters, Zeppelin notebooks, or machine learning engines, to make the IRIS for Health applications even more efficient. Let's take a closer look at how these different components work together in the process of discharging a patient and minimizing their risk of readmission. The first component in this demo, the Simulated Health Information System, consists of an Angular user interface and an IRIS for Health backend. This backend is called from the UI using REST services. Other clinical data sources outside of this particular health system may also be fed into the IRIS for Health database on the back end of this information system. These data sources could come in a number of different message formats, such as FHIR, CDA, IHE, and others. Messages in any format can flow into the Intelligent Integration component. The primary example in this demo uses HL7 messages. The integration component, another instance of IRIS for Health, extracts relevant data from these messages and routes it along to the enterprise data component. We'll come back to this integration component in a moment. Over on the enterprise data component, the third and final instance of IRIS for Health in this example, a number of different things are happening. First, the clinical data received from the integration component is stored in a normalized IRIS for Health database, where machine learning and analytics experts can easily work with the dataset. This data component can also include cubes and dashboards that help analysts see the business impact of the application and relevant trends in patient data. Additionally, this system will compute a LACE score for a given patient's readmission risk. LACE is an industry standard index for measuring readmission risk. We will revisit this later. Finally, the data component will connect to an external cluster that includes Apache Spark and Apache Zeppelin via the InterSystems Spark connector. This cluster will be the analytics and machine learning cluster. In this demo, the Spark cluster is used to build a machine learning model that can be imported back into IRIS for Health as a PMML file. This machine learning model can produce comprehensive results based on a wide range of factors. Using data from various sources for a given patient, a machine learning model can take into account a patient's history. It can consider his or her past hospitalizations or emergency department visits, the conditions diagnosed or discussed in those visits, whether those visits resulted in readmissions, and more. Many factors beyond those in the traditional LACE model can be helpful in assessing whether this patient, for this visit, is at risk of being readmitted. After loading the PMML file with our machine learning model back into IRIS for Health on the enterprise data component, the machine learning-based risk score can be calculated. We'll call this the ML score. These scores are sent back to the integration component, where the risk scores can be acted upon. If the risk scores exceed a certain level when a patient is discharged, workflows and alerting will be triggered, and the care team can take appropriate action to mitigate readmission risks. Let's take a look at this application in action. We'll start in the health information system, where we have a patient who is soon to be discharged. The patient is Frederick Masters. Let's search to pull up his admissions profile. Opening up Frederick's admission information, we can see right away that both of our readmission risk scores are tied into the health information system, the LACE score and the ML score. We mentioned earlier that LACE is an industry standard index for measuring readmission risk. These scores range from 0 to 19, and any score 10 or higher is considered to be a high risk for readmission. Here, that score is transformed into a percentage to reflect the likelihood of a readmission. The factors considered in this index are length of stay, acuity, comorbidities, and emergency department visits over the last 6 months. In this example, we can see that our machine learning model generated a score for Frederick that indicates a greater than 50% probability of readmission if no recommendation is provided alongside the discharge. The LACE score, on the other hand, is significantly lower. The machine learning score is based on a wide range of factors that might not otherwise be considered. Of course, before even discharging the patient, these scores could help the care team take further action to prevent his readmission. such as extending his stay, referring him to another physician, or prescribing him a new medication. Here, let's take a look at how the score might be impacted if we add a follow-up care recommendation upon discharge for Frederick to visit a nursing facility. As it shows here, the readmission risk drops significantly with the addition of a follow-up care recommendation. In this example, we will discharge Frederick with the recommendation to visit a nursing facility and see how this works in our system. This is the message viewer in our intelligent integration component. At the top of this list, we can see a recent message originating from HIS HL7v2 TCP feed. Looking at the contents of this message, we can see that it's Frederick's discharge message. So, what is HIS HL7v2 TCP feed referring to? Looking at the production configuration for our integration, we can see the business components that comprise our logical flow of information. HIS HL7v2 TCP feed is a business service that accepts messages from the health information system and sends them along to our routing process. Ultimately, these messages are going to be passed to the readmission risk process component. As you can see, this process can send information to a number of different destinations. It will call business operations to calculate the LACE and ML scores, initiate care team actions, and update the health information system with data for the patient's visit. Knowing the various components that exist in our integration, let's review the message that came through for Frederick's discharge. We'll look at the full visual trace of this message to see how it was routed through our environment. Here we can see the various messages being sent between components in our integration. Notice all of the different messages being sent by the readmission risk process that we looked at in the production configuration. For instance, if we click this risk response message that comes back from the LACE operation, we can see the information in the message for the LACE score calculation. Similarly, if we look at the score response message coming back from the readmission ML operation, we can see the machine learning generated score for Frederick's readmission risk, which was significantly higher. The next three messages being sent from the readmission risk process align with what we saw earlier: a message to the health information system, a message to the care team operation, and another to the email operation. All of this orchestration and routing is key to the process of determining Frederick's risk for readmission and offering options for care to best prevent it. One of the really helpful features of InterSystems IRIS for Health is its low-code user interface for designing logical processes like this one. Let's take a look at the readmission risk process in the Graphical Business Designer. This should look rather familiar, as it is the logic behind the trace that we just viewed. This process calculates the LACE and ML scores. Recall that this uses business operations to call the enterprise data component for the calculations, and then acts based on the results. A little farther down, notice that our current logic will trigger the care workflows and alerts if the LACE score is above 15 or the ML score is above 50. Based on the results, the rest of the actions follow suit accordingly. Back in the health information system, by looking at the Workflow tab, we can see there is an unassigned task for a patient at risk of readmission. This patient is Frederick. The clinician can accept this task to follow up with Frederick and then enter the action when it has been completed. InterSystems IRIS for Health enables you to build intuitive and integrated applications like this one, and there is a whole lot more to explore within these systems. We didn't explore the machine learning and analytics component in this demo, but recall that the calculation of the ML score relied on a machine learning model that our data scientists honed within the analytics environment. If you're ready to build the application that will improve the well-being and care of patients at your facilities, the possibilities are unbounded with InterSystems IRIS for Health.